So just a few minutes on modern total knee design. Our preference is to take out the PCL or the posterior cruciate ligament. So most knee replacement surgeons take out the ACL. We also take out the PCL. So the ACL and the PCL are the two ligaments that prevent the tibia from dislocating forward or backwards on the knee. So you need to stabilize for that. So there has to be something inherent in the design of the knee to prevent the tibia from dislocating. In traditional posterior stabilized knee replacements, there's actually a plastic post that sits up in the center of the knee, and that post will actually engage with the femur and block it and prevent it from dislocating. The trouble with that design, in my opinion, is it simplifies the knee to a two-dimensional hinge. The reason we like this design in particular, which is called a sphere knee, it's a medial constrained medial rotational type knee that gives all of its stability through this ball and socket, is that by removing the post and creating sort of a ball and socket here on the medial side, all of the studies we've done show that this more closely replicates the normal biomechanics of human knees. So when knees in real life, if this wasn't a replacement, when knees bend and extend in real life, they don't just do this. They're not just a simple hinge. They bend and rotate during flexion. In fact, during deep flexion, the knee rotates back and actually lifts off and opens up a bit. So this particular knee design was designed with some world-class biomechanical engineers and surgeons. And the end result is we feel like this gives patients better stability in mid-range of motion. So with climbing stairs and telemark skiing and downhill skiing and golf, where you rely on some rotational stability as well as some front to back stability, we feel that this ball and socket type design or mechanism, which we have here in the sphere knee, is superior to the traditional post. And you're going to see a lot of companies moving towards this knee design in the future. So this is just an illustrative example of the type of report that surgeons will get to create these models. This is called a MyKnee Surgical Planning Report. It has the patient's initials and all the different things that surgeons will look at in terms of coming up with a final plan in terms of the resection levels, the angles on the femur and the tibia. So this is how we build the algorithm, if you will, to create these on a 3D printer and then send them to the surgeon so the surgery is done extremely accurate and on a patient-specific basis.